Hi everyone, it's Erin with Therapy Care, and today I'm discussing the difference between speech and language because I found that many people think they are one and the same. However, they are two different skill areas, and a person can have problems in either one of these areas or both simultaneously. I think it's important for parents and even teachers to be educated on these various skills so they are able to identify possible delays in children and seek out help for them. I have noticed also a common misconception is that speech pathologists only treat kids who, can't say their R's correctly or who have a lisp or something like that. So that's also why I want to talk about speech and language and the wide range of skills that those terms are actually encompassing. So when we talk about speech, we are talking about how we say words and sounds. And so speech includes articulation, which is how we make speech sounds using the mouth, lips, and tongue. For example, when a child has difficulty saying the R sound and they say wabbit instead of rabbit, that is an articulation problem. Speech also includes voice, which is how we use our vocal cords and breath to make sounds. We look at how loud or soft the voice is and how high or low pitched the voice is. Our voice production can be impaired from talking too much or yelling or even from coughing a lot, or sometimes a voice disorder can occur from neurological damage as well. So speech also includes fluency, which refers to the rhythm of our speech. For example, it is considered a disruption in your speech fluency when we sometimes repeat sounds or pause while talking. So a fluency disorder that many people are familiar with is stuttering. So when we use the term speech, we are talking about articulation, voice, and fluency. But on the other hand, we have language. So we have expressive language, which refers to words we use and how we use them to share our thoughts, feelings, and ideas. And then we have receptive language, which is our ability to understand or comprehend what others say. So language includes the meaning of words and how we put words together, so grammar and vocabulary. It also includes what we should say based on where we are or who we're talking to. So in other words, how we use our language socially, which that's called pragmatic language. So for example, how we use different language when we're talking to a friend rather than when we're talking to our boss, or a child uses different language styles when talking to a parent rather than when they're talking to a teacher. So when we have trouble saying words or stutter when we speak or have voice problems, we have a speech disorder. And then when we have trouble understanding what words mean or using words to talk to others, or difficulty with grammar, reading, and vocabulary, that's considered a language disorder. And so speech and language disorders are often developmental and start in early childhood, but they can also be caused by brain injury or illness at any stage of life. Speech-language pathologists diagnose and treat both speech and language disorders in children and adults. So you can send me an email at ejackson@therapycare.com with any of your concerns about your child's speech and language development. Thank you for listening.